Hi, my name is Katelynn Atwood. I'm a respiratory student at Vermont Tech, and I'm here today to talk about the use of mechanical chest physiotherapy. The agenda for this presentation is first talking about the problems with the current therapy, such as patient discomfort, therapist discomfort, and it is also very time-consuming. So the next thing I'll be talking about is the solution, which is mechanical chest physiotherapy, and how much money it will cost to implement this project, and I'll be ending with any questions. Manual chest physiotherapy can be hard on the patient's bodies. To perform the manual chest physiotherapy, it requires the therapist to percuss over the different lung segments using their hands, so a motion kind of like this, repetitive but very fast. This has been known to cause redness near the sites, irritations, and other complications for the patients. So in a recent case study, Dr. Snow has questioned the use of mechanical chest physiotherapy, saying that chest physiotherapy techniques, in particular the percussion, might harm the lung function of patients with an exacerbation of COPD. The repetitive motion the therapists use is both uncomfortable and can cause long-term damage to the therapist's body because it is the repetitive motion. According to the U.S. Bureau of Labor Statistics, nearly 2/3 of all occupational illness reported were caused by exposure to repetitive trauma to workers' upper body. So it's the exact same areas that the therapist would be using to give this therapy to the patient. According to Jane Briverman, typical treatment sessions last 20 to 30 minutes and may be required up to 3 times daily. So it is easy to see how manual chest physiotherapy is very time consuming for both the patient and the therapist, in particular the therapist, because it's not just one patient typically that you're giving this therapy to, it's multiple in a day, up to 10. So the solution to this would be mechanical chest physiotherapy, and this therapy works by using compressed air to inflate and deflate the vest, which makes the high frequency chest wall oscillations. All lung segments would receive the oscillation at the same time. So all the therapist would have to do is adjust the vest to the patient, and then on the vest there's holes where you would put the tubing, and then you would go to the machine and select the hertz or the frequency and the duration of the therapy depending on the doctor's orders. And then after the therapy is done, which usually only takes 3 to 5 minutes, you would just take the vest off the patient and set it aside for the next round, for the next treatment. So this would solve our current problems with the old therapy because the therapy is passive and it also yields better sputum production, so it's better for the patient. They don't have to move around a lot, and it also is better for the lungs. It also reduces the long-term work-related injuries because the therapist does not have to do these repetitive motions anymore. All they have to do is hook the patient up to the machine and it does the rest. So as you can see, it also saves a lot more time, and it will reduce the labor time by 25 to 75%. So I have in this next slide pictures of, on the left there's a patient passively, so calmly receiving the therapy, and so that she doesn't have to be repositioned and she can just sit in a chair upright, which is nice. Typically they have to lay down and move around on a bed. And on the right upper hand corner is a handheld percussor, and on the bottom is a oscillatory machine, so oscillator, that has a different skin on it. So Bugs Bunny, they have a lot of different skins you can get for it, but I think that this would help make the younger patients more, it would make them more apt to do their therapy, encourage them a little more. So the budget for this project would be $112,500 in total. So $100,000 would go to the 20 Hill-Rom airway clearance systems with the tubing and vest included in that, and $12,000 would go to the extra tubing that you might need and the extra supplies for the system, and $500 would pay for a trainer for 8 2-hour sessions, which just gives you your total of $112,500. So our goal of this project is to better the patient care, so they're more apt to do their therapy if it's easier and it doesn't take as much time. If it only takes 3 to 5 minutes versus 20 to 30, they're more apt to do their therapy, and it's also better for the younger kids too because they don't have to sit in one spot. It will reduce the long-term work-related injury because the therapist isn't going to be doing those percussions. and it also will save time and ultimately money for both the patient and the healthcare provider. And any questions? Okay, thank you for your time.